Thank you, Chairperson. Today we introduce new machine learning-based gait analysis model to predict clinical Frailty scale in elderly patients with heart failure. And this is my COI. Frail is a syndrome characterized by an exaggerated decline in function and reserve of multiple physiological systems. In Japanese, so yobo condition. And Frailty and heart failure often share common pathophysiological mechanisms and often coexist and associated with worse clinical outcomes. And the prevalence of frailty is known to be higher in elderly patients with heart failure. The national prevalence of frailty in the elderly population range 7 to 30%. However, the prevalence of frailty in the elderly patient with heart failure range 59 to 88%. It's very higher than non-heart failure patients. Frailty is also known to worsen the clinical outcome in the patient with heart failure. In Japanese cohort, higher frailty was associated with worse clinical outcome. And the meta-analysis also revealed that the higher frailty increased the risk of mortality. Therefore, it is extremely important to evaluate the frailty accurately to determine the treatment strategy for heart failure. One of the most widely used screening tools in detecting frailty is clinical frailty scale, CFS. CFS provides an intuitive assessment and easy to use so there's no additional cost, requires no additional cost and effort. And therefore, CFS is used in real-world clinical practice. For example, the guidelines on the management of valvular heart disease from Japanese Circulation Society also recommend to assess the patient's frailty using CFS. However, CFS is evaluated subjectively. So there are, in the study, the specialist and resident. CFS is evaluated subjectively, so there are several interpretive barriers. In the study, specialist and resident evaluated CFS. The concordance rate of CFS assessment was considerably low between the specialist and residents. And there are several frailty assessment tools other than CFS. However, the concordance rate between frailty assessment tool is not sufficient. And there is no consensus regarding how frailty should be measured, and the development of emerging objective tools for the assessment of frailty is warranted. In the last decades, deep learning and machine learning techniques have shown great capabilities in image and video analysis in the medical field. One of them, OpenPose, which is a deep learning-based T-point detection algorithm, allows us to acquire T-point of the subject from images and videos. In Body 25 model, OpenPose tracks 25 key points described in this figure. In the study that used OpenPose to rate Parkinson's disease, machine learning analysis enables objective diagnosis of Parkinson's disease with accuracy equivalent to medical specialists. Accordingly, we aimed to develop a machine learning-based automatic rating method system model of clinical frailty scale based on gait analysis in patients with heart failure. We enrolled elderly patients with symptomatic chronic heart failure from 7 sites between January 2019 and October 2022. Patients were divided into derivation dataset and validation dataset according to the enrollment size. The gold standard CFS was evaluated by 10 trained cardiologists using the modified Delphi method. In the derivation dataset, necessary cross-validation was performed to create light GBM model. And after the light GBM model was established, the model was tested in the validation dataset. And we create L-shaped walking course to evaluate walking motion. Patients stood up from the chair, and walked 2 meters. Do you see? Okay, 2 meters, and turn right and walked meters and stopped at the second blue marker. The blue marker was placed at the floor as a distance reference point. Movie was recorded with iPod Touch 7th generation. The iPod Touch video resolution is 1080 HD video, and the frame rate was 30 frames per second. The iPod Touch was placed at 4 meters horizontal away from the second blue marker and 1 meters away from the floor, vertically away from the floor. And this is a recorded movie. A patient stood up from the chair and walked 2 meters and turned right at the first blue marker and walked 2 meters, stopped at the second blue marker. The key point detection was performed using open pose and single shot multipulse detector. Open pose was used for body tracking, and the single shot multipulse detector SSD300 was used for the detecting the key point of the marker placed at the floor. These algorithms was worked on Jetson AGX Xavier, which is a small computer, which has 512 core NVIDIA Volta GPU with Tensor Core, and which operating system is Linux. OpenPose outputs the data for the X coordinate and Y coordinate and the accuracy of the 25 key points. For data cleaning, if the accuracy value was less than 0.8, the average of the 6 frames before and after was used. And in open pose estimation, there are several misdetections in the left foot and right foot estimation. To solve this problem, we create anomaly detection algorithms, and misdetected data were corrected using spline interpolation using the previous and the following values. After input operation, there's no misdetections like this. This video is a result of a key point detection after these correction procedures. From these key points, we evaluate the gait motion. For example, we calculated the spine angle using this formula, and we evaluate the bend angle of standing up and trunk swell of frontal gait like this. And this is another example as a right ankle tick estimation analysis. Blue marker is X coordinate, Y is speed, and green is acceleration. Patients stood up and kick and tick and kick and turn right. So we can identify the final tick frame using the tick minus tick acceleration. So this is a final. We estimate this is a final tick frame. So we check again. So patient stood up from the chair and tick and tick and tick. So when the tick is stopped, there are enormous minus tick frame, minus tick acceleration. So we can identify the final tick frame like this. So in this way, we calculated 128 gait-related features from the detected points. And to evaluate gold standard CFS based on the obtained Gait videos, we asked 10 trained cardiologists to evaluate CFS using the modified L5 method. In step 1, the 10 trained cardiologists judged the CFS from the walking video, only the walking video. And in step 2, the cardiologist judged CFS again from the Gait video and the summary of the result of step 1. And we adopted the converged assessment as gold standard CFS. Using 128 gait-related features and gold standard CFS, nested cross-validation was performed in the derivation dataset and create light GBM models. Light GBM models output was Frailty level as continuous value and predicted CFS as an integral value from calculated from Frailty level. So we move on to the result. There are no significant differences in age or NYHA score. That means heart failure severity between the derivation and the validation dataset. And there is no significant differences in the distribution of gold standard CFS between the derivation and the validation dataset. And this is the major Gait parameters. So the patient with higher CFS had a lower gait speed, slower gait speed, and shorter gait widths, and higher stance phase, and longer total gait time, and slower ankle swing speed, and lower ankle momentum than the patient with lower CFS. And in the model development, 5-fold cross-validation were repeated 50 times in each 10-fold cross-validation. From 128 features, 45 features were selected according to the sharp values. And the light GBM model was trained using the selected 45 features in the 10-fold cross-validation and tested in the validation dataset. And this is a key figure in this study. In the derivation dataset, light GBM model showed an excellent agreement between the gold standard and predicted CFS. The coins weighted kappa was 0.866. It's very high. And in the validation dataset, light GBM model also showed an excellent agreement between the gold standard CFS and predicted CFS. The coins weighted kappa was 0.812. It is also very high. And none of the patients had a two-stage or overestimation error in the derivation and validation dataset. And to compare the light GBM model with human raters, we selected 3 independent non-trained cardiologists and asked them to predict CFS from the walking videos. And the light GBM model achieved a higher agreement rate than the non-trained cardiologist. And during the median follow-up period, 391 days, all-cause deaths occurred in 33 patients. Multiple Cox regression analysis revealed that higher predicted CFS and higher Frailty level were independently associated with all-cause deaths, even after adjusting for heart failure prognostic models. So we create this model and the system using this machine, Xavier. So we should create an application working on an iOS device to make it use easier. So we have to move key point detection algorithm from Xavier to iOS device. The major algorithms for key point detection is OpenPose. This is cafe version And OpenPose officially recommend to use cafe version. However, it is difficult to use in iOS device. It is difficult to use cafe model to use in iOS device. So we have to change the model. So we use the Core ML. We create Core ML version. Core ML is a machine learning framework provided by Apple, and Core ML can also use converted models trained in other machine learning frameworks. So we check the performance of this new algorithm using iOS device. So unfortunately, the Core ML version of OpenPose did not provide sufficient performance. There are several misdetections during the movie, like this. Maybe this is misdetection. This area in this area like human, so there's some misdetections. And thus, we investigated to the use of VIT pose as a new T-point detection algorithms. VIT pose based on the vision transformer architecture and is more lightweight than OpenPose algorithms. And we create VIT pose Core ML version and check the performance in iOS device. So this is the last case that OpenPose failed to detect the key point. VIT pose could detect the patient's motion correctly. And this is another example of OpenPose failing to detect the subject. The patient was stumbled. There are some misdetections. This area. So patient stumbled, no detection. However, VIT pose can detect correctly. OpenPose also misidentifies the key point when the patients use a walker like this. So the walker hide the patient's foot area, and the OpenPose misdetect patient's foot area. However, VIT pose is useful to analyze. And when you use a walker, the big size, so which is easily hides the feet. So both OpenPose and the VIT pose misidentify the key point. The frontal walk, we can't identify the foot motion, and VIT pose can't identify the foot area. And this is the only case in which VIT pose failed to recognize the key point, like this. So backlighting is very strong, and the black clothing, the patient's clothes wears the black clothing. That's the reason. So VIT pose failed to estimate the motion. And this is a summary of the result of performance of pose estimation. And Xavier and OpenPose detect all patients. However, the OpenPose Core ML version misdetect 12 patients, and VIT pose Core ML version misdetect only 2 patients. So we use this model to create an application. And this is a summary of the features of OpenPose and the VIT pose. OpenPose as the base architecture is CNN, and VIT pose architecture is vision transformer. It is lightweight than OpenPose CNN. So VIT pose requires OpenPose requires GPU. However, VIT pose requires only Apple's neural engine or GPU. So VIT pose is better compatibility with Core ML. And the memory usage is lighter than OpenPose. And Open Pose, so BIT Pose is suitable for mobile application on Apple devices. So we created smartphone application of Frailty Finder using the development model, and we introduced it. So this is just little old movie. It is open pose version. It's almost the same. So we enter the patient's information manually and record the movie. And there are some guidance. This is my friend, Dr. Mizuguchi. And sets the camera. And stand up from the chair and walk 2 meters and turn right and walk 2 meters and stop at the second blue markers. The application can identify the markers placed at the floor. And only 15 seconds to detect the patient's key point. And only after 30 seconds, after the movie record was finished, we can acquire the estimated CFS like this. There are some details. So estimated CFS was 3.5. In this study, we developed a machine learning-based automatic rating system to evaluate the CFS in elderly patients with heart failure. This system has a very good reliability in comparison with trained cardiologist assessment. Higher predicted CFS was independently associated with risk of all-cause death. And BIT Pose Core ML version has the best pose estimation performance when running on iOS. So we conclude that machine learning-based algorithms that automatically raise the CFS are feasible. And the predicted CFS is associated with the risk of all-cause death in elderly patients with heart failure. And this study was conducted in collaboration with AMED, and an investigator-initiated clinical trial is planned this year, supported by AMED. Thank you for your kind attention.